Hi, I'm Brooke Leary,
And I'm Grant Dailey.
and we're here today to talk about some of the key findings and recommendations from our audit of safety in adult jails in King County. Violent incidents like fights and assaults happen regularly in King County adult jails, and the impact to people in custody and people working in jails can be serious. King County books more than 30,000 people into adult jails each year, and a disproportionate number of them are Black and Indigenous people. DAJD generally does not have control over who is booked into the jail, but they do have control over operations within the jail. And as part of our work, we found clear racial disparities in housing and discipline, meaning Black and Indigenous people who are incarcerated in King County are more likely to face negative consequences in jail, like higher security housing, more rule violations, and more severe punishment for those violations when compared to other people in custody in King County. The results you're about to hear are based on rigorous and comprehensive analysis of jail data that has been checked by independent auditors as part of our standard quality assurance process. The audit team analyzed data including more than 2,300 violent incidents reported in King County adult jails between 2017 and 2019, interviewed a cross-section of 22 corrections officers and 16 people in custody, and analyzed available demographic data for more than 100,000 bookings, 75,000 security and classification scoring decisions, and 17,000 disciplinary actions. This is information the jail has not reported on publicly in the past, and bringing transparency to issues relating to safety in King County jails is an important element of this audit. There are a couple of limits to our work I want to mention, primarily that we did not analyze demographic data on Hispanic Latinx populations in the jail due to data reliability concerns. Before I go on, I want to mention that we will be discussing sensitive content in this presentation, including discussions of violence and suicide. Resources are on this slide for anyone who needs them, and I'll return to this information at the end of the presentation as well. We have four main sections today. First, people being housed in close proximity to one another in the jails leads to increased numbers of violent incidents, and a reduced population in the jails is key to maintaining a lower level of violence. During the pandemic, the county has made good progress towards reducing the jail population, and we'll talk today about other key steps the county should take to reduce violence. Second, we also found that the demand for psychiatric housing in the jails exceeds the supply, and the problem has been growing in recent years. This can have impacts on safety of both people in custody and employees, and we identify steps the county can take to address this. Third, between 1 and 6 people die in custody each year, and we identify some steps that DAJD and jail health services could take to help prevent future deaths. And finally, as I mentioned before, our analysis shows that Black people face a more restrictive punitive jail system, with bias in some of DAJD's processes, resulting in higher security housing and more discipline for Black people, and particularly for Black women. We identify steps DAJD can take to address these disparities. To start, I want to begin by very briefly covering some quick background information. Our audit examined the safety of people who work at or who are in custody at adult county jails. This audit examined the 2 adult detention facilities in King County. That's the King County Correctional Facility, also known as KCCF in downtown Seattle, and the Mae Lang Regional Justice Center, or the MRJC in Kent. There are a few differences between the 2 facilities. For example, KCCF has a higher average daily population than the MRJC, which you can see highlighted on the slide. KCCF also houses people with higher security classification and provides medical and psychiatric housing for those with more serious health needs. At the core of much of our analyses were data on violent incidents spanning from 2017 to 2019. You can also see that violent incidents were more common at KCCF than at MRJC, due in part to some of the differences I mentioned a few moments ago. Throughout this presentation, you'll hear us refer to violence or violent incidents, but what exactly do we mean by violent incidents? Based on DAJD incident data, violent incidents include fights, assaults, verbal threats, spitting, biting, throwing of items, and threats made with a weapon. As you can see, fights and assaults make up the vast majority of violent incidents at both jails. Since KCCF has a higher average daily population, it's not surprising that they also have more incidents. However, we found that KCCF also has a far higher rate of violent incidents when you account for population. When looking more deeply at these violent incidents, we accounted for differences in the number of people housed in each location. To do this, we analyzed the frequency of violent incidents on a per 1,000 average daily population rate, and found that KCCF experienced a higher rate of violent incidents. at a rate of 528 per 1,000 average daily population per year, compared with 183 per 1,000 at the Mailing Regional Justice Center. Let's break that down a little bit more. Of those 528 incidents at KCCF, 368 per 1,000 were between people in custody, and 160 per 1,000 were violent incidents against staff. At MRJC, in comparison, the rates were much lower, with 146 per 1,000 incidents between people in custody, and 37 per 1,000 against staff. As you can see, staff at KCCF were 4 times more likely to be assaulted than were officers at MRJC, resulting in more lost workdays and issues of frequent mandatory overtime. While we controlled for differences in the number of people in each facility in this analysis, it's worth noting that there are a number of factors which might contribute to this difference between the facilities, such as differences in the infrastructure and the different medical and psychiatric needs of people in custody at KCCF compared to MRJC. And while this analysis focused on violent incidents spanning from 2017 to 2019, the COVID-19 pandemic and its impact on jail operations allowed us to further examine some of the factors that drive violent incidents. And that brings us to our first major finding today. The changes in jail operations that were brought on by the pandemic led us to a finding about proximity and violence. While there were many factors that can influence violence in the jails, one that we heard in our interviews with both county staff and people in custody was that the practice of double bunking contributes to violence in the jails. Double bunking is when 2 people share a single cell. We heard that the tensions of sharing a living space or close quarters with another person can spill over into increased violence. In 2020, the population across both jails decreased rapidly from approximately 1,900 people average daily population total across both facilities to 1,300 total. This was done by the jail in conjunction with their partners in the criminal legal system to combat the spread of COVID-19. Along with this decrease in population, the facilities employed social distancing strategies to combat the pandemic, including a reduction in the number of double bunked cells, and this was particularly true at KCCF in downtown Seattle. The green dashed line on this slide highlights the average daily population level at which either facility would have to begin double bunking people in cells to meet capacity demands. What you see here is that KCCF routinely double bunked people in custody during the years 2017, 2018, and 2019 because its population was too high to accommodate housing only 1 person per cell. In comparison, MRJC very rarely needed to use double bunking during this time period. In 2020, the reduction in jail population meant that people in custody at KCCF could now be housed individually with increased personal space. And as you can see, the bar for 2020 is now well below the green line. So we wanted to examine whether the decrease in population had any connection to the level of violence in the jail. Our analysis found that in 2020, the 47% decline in the jail population at KCCF was connected with a 63% decline in violence. This may be associated with that increased personal space and lowered tension that resulted in the reduction of double bunking at KCCF. In comparison, at MRJC, the population dropped by 15%, but there was only a 4% decline in fights and assaults. This may be because MRJC already maintained 1 person per cell prior to the pandemic and therefore did not experience as pronounced of a decrease in fights and assaults. Corrections officers we interviewed said that the reduced population has helped lower the amount of violent incidents by giving people in custody more personal space, lessening general frustrations from living in close quarters, and also reducing the ratio of people in custody to corrections officers, allowing for easier oversight. It's worth noting that lowered population and limited movement time within jails may have both benefits and drawbacks for those in custody. During interviews, people in custody reported that increased social distance has helped them lessen interpersonal conflict and has increased safety from infection of COVID-19. However, some changes may have also increased the levels of stress for people in custody due to the lack of meaningful activities and limited access to day rooms. The impact of the lower jail population and increased personal space are important factors to keep in mind as the King County Council and the King County Executive have worked together to develop a plan to close the floor of the downtown adult jail by July 2022. Currently, the stated goal is to maintain the current average daily population of around 1,300 combined across both jails. If population levels are not kept low as planned, the closure of the floor in 2022 would likely cause DAJD to resume double bunking at KCCF, and may therefore lead to increased numbers of violent incidents in the jail. In alignment with current county goals, our report makes the recommendation that DAJD work with its partners in the criminal legal system, such as the prosecuting attorney's office and the courts, to keep population levels as low as planned in order to avoid double bunking. The executive branch has not concurred with this recommendation and notes in their response that to implement it would require opening a new jail facility. That is not necessary to implement our recommendation, and we provide more information in our auditor comment at the back of our full report. Now I will pass it over to Grant, who will go over the next two sections of our presentation.
Thank you, Brooke. Mental health is an ongoing regional issue, and our report highlights some of the challenges that this presents for the Department of Adult and Juvenile Detention. As part of our analysis, our team examined the counts of all people in need of psychiatric housing and the counts of people who were actually placed in psychiatric housing between 2017 and 2019. In doing so, we found that housing needs are routinely unmet. To provide context, the 7th floor of KCCF in downtown Seattle has been specifically designed to accommodate those with psychiatric needs. For example, cells have been retrofitted to be suicide resistant, and there's a range of different housing options within the 7th floor based on the security level, gender, and individual health needs of a person. If there are no available beds on the 7th floor, people who require psychiatric treatment are housed in a different location of the facility instead, sometimes referred to as overflow housing. This slide shows the number of people in need of psychiatric housing who were not assigned to the 7th floor and instead were placed in overflow housing. Overflow use was comparatively low in 2017. Since the 4th quarter of 2019, however, there have been on average 18 people in custody each day who need psychiatric housing but are placed in locations outside of the designated psychiatric location of the 7th floor due to a lack of space. Since there's not enough excess capacity on the 7th floor to adapt to the changing needs, classification staff must frequently repurpose different areas of the jail and then subsequently ask officers to move people from area to area as the population fluctuates. This means that at times, some people with serious mental illness can be placed in housing that is more restrictive than necessary if there's not enough space in the designated psychiatric housing location. Or people may be placed in a location where access to care is more difficult. This also leads to instances where corrections officers located in these alternate locations are not prepared to interact with or otherwise care for people who are exhibiting mental health symptoms. In 2017, this sort of use of overflow capacity was still relatively uncommon. There were no people in this overflow housing location for 60% of the year. However, between 2017 and the 4th quarter of 2019, the need for psychiatric housing in the jail increased by 27%, but the number of beds in the psychiatric housing unit did not increase. Furthermore, even though the overall population in the Seattle jail has decreased in 2020 during the pandemic, there were still an average of 11 people in overflow housing each day. In response to the consistent use of overflow housing and the challenges it presents to providing consistent care to those in need, we recommend that DAJD work with jail health services to ensure that people that are housed in overflow locations receive care that is commensurate with those housed in designated psychiatric housing. For the next portion of the presentation, I will cover information about deaths in custody. This graph shows the number of deaths in custody that occurred each year since 2009. Since 2009, between 1 and 6 people have died in custody each year. DAJD's goal is to have 0 deaths in custody in any given year. Overall, the current mortality rate in King County adult jails is on par with the average for Washington State, but is slightly above the national average. To better understand why people died in custody, we reviewed investigations spanning from 2017 through 2020, as well as data from jail health services on the medical examiner's determination on the manner of death. Over this 4-year period, 17 people died in custody. 6, or 35% of these deaths, involved drug intoxication or withdrawal. Another 4 deaths, or 24%, were from suicide, 2 each in 2017 and 2020. And finally, at the time of our review, the medical examiner had yet to determine the manner of death in 2 cases. When examining the circumstances surrounding these natural and accidental drug-related deaths, reports indicated that natural deaths involved opioid withdrawal. Accidental drug-related deaths involved acute drug intoxication from opiates, methamphetamine, cocaine, and other drugs. Across these instances, JHS and DAJD noted that there was a lack of clarity in roles and responsibilities for responding to medical emergencies. JHS also cited a need for staff to better understand opioid withdrawal treatment. As a result, we recommend that DAJD have specific annual in-service training requirements that relate to preventing drug-related deaths. During our review, we also noted that there were 4 suicides, but none of these happened in suicide-resistant cells, indicating that these cells are working. Suicide-resistant cells lack ligature points and porcelain fixtures, which could be used for self-injury. All of the cells designated as psychiatric housing on the 7th floor of the Seattle jail have suicide-resistant design. Even though people with the highest known suicide risk are housed in psychiatric housing, no suicides took place on that floor between 2017 and 2020. Instead, suicides took place in restrictive housing and on the 8th floor, neither of which have suicide-resistant cells, even though restrictive housing is correlated with suicide risk. As a result, we recommend that DAJD and JHS take a risk-based approach to increase the number of suicide-resistant cells at county adult jails. And now I'm going to hand it back to Brooke to finish the last portions of the presentation.
Thanks, Grant. In this final portion of our presentation, I'll discuss our findings related to racial disparities in housing and discipline. We found that Black people in custody were overrepresented in higher security housing, and that Black and Indigenous people in custody faced more time in disciplinary restrictive housing. In contrast, white people were overrepresented in lower security housing and received fewer days in restrictive housing per infraction. I'll go into more detail about these conditions in the next several slides. DAJD houses people depending on their security classification. King County adult jails have 4 security classifications. Shown here, they are minimum, medium, close, and maximum. These classifications matter because people in higher security housing have fewer privileges, such as less contact with other people and less time outside their cells. In our review of demographic data for 98% of all classification decisions between 2017 and 2019, we found that Black people in custody were overrepresented in higher security housing. At the bottom of this slide, you can see the average jail population for 2017 to 2019 broken down by race. When we look at the population of people in medium security for comparison, we see that the racial breakdown is similar to that of the population overall. However, at the top of this slide, the breakdown shows a disproportionately high number of Black people in the highest security classifications, namely maximum and close security. In contrast, at the minimum or lowest security level, the opposite is true, with Black people clearly underrepresented and white people overrepresented as compared to the jail population. So how does DAJD assign people to these housing levels? DAJD staff decide security classifications using the combination of 2 different scores, a management risk score and a criminal involvement score. Both scores together determine a person's security classification and therefore their housing within the jail, and both scores contribute to racial disparities in housing in different ways, which I will discuss in more detail. First, the management risk score adds bias through unclear qualitative criteria. DAJD classification staff assign a score to quantify a person's risk based on assessing their attitude and behavior. For example, the difference between a risk score of 2 and a risk score of 5 is the difference between someone being assessed as occasionally aggressive as opposed to consistently defiant. This is an inherently subjective judgment to have classification staff make, and these different management risk scores in turn can lead to higher or lower security classifications. Over the period of 2017 to 2019, we found that the management risk score was on average 13% higher for Black people than other people in custody and 8% lower on average for white people. In 2011, the National Institute of Corrections recommended that DAJD develop quantifiable criteria, such as the number of violent infractions over a given period, to reduce subjectivity in its management risk score. DAJD did not implement this change, so due in part to these scores, county adult jails see Black people overrepresented in higher security housing. Second, I'll talk about the criminal involvement score. The criminal involvement score perpetuates bias that exists in the criminal legal system. Research shows that due to systemic racism, Black people in the United States are more likely than white people to be arrested, more likely to be charged with crimes that carry heavier sentences, more likely to be convicted, and more likely to be incarcerated. These conditions listed on the left factor into the criminal involvement score that DAJD uses to determine a person's security classification. DAJD does not have control over the criminal involvement histories of people in its custody, but they do decide how and whether to use such factors to set security classifications. By relying on these factors, DAJD gives Black people in custody much higher criminal involvement scores and thus higher security housing than white people in custody. Based on these findings, we recommend that DAJD revise its classification scoring system to reduce the extent to which systemic racism and individual bias contribute to disproportionately high security levels for Black people in custody. We also recommend that DAJD regularly check and adjust the scoring system to ensure that disparities do not continue. I'm now going to turn to discipline, by which I mean placement in restrictive housing for violating jail rules. We reviewed 99% of all disciplinary actions in King County adult jails between 2017 and 2019, and found that Black and Indigenous people in custody face more time in disciplinary restrictive housing. This means that they were more frequently removed from their assigned housing unit and placed in a different unit with fewer privileges, including a reduction in out-of-cell time to 1 hour per day. The spike on this graph shows that Black women on average received 70% more days in restrictive housing per infraction compared to other women. Meanwhile, Indigenous women received 18% more days in restrictive housing per infraction than all other women. In contrast, white women received 40% fewer days in restrictive housing than all other women. We also found that Black men received 24% more days in restrictive housing per infraction than all other men. Unclear criteria for handing out infractions and discipline contributed to these trends. For example, there are 3 levels of rule violations in the jail: general, serious, and major. Only serious and major violations lead to disciplinary restrictive housing. For instance, officers decide whether to write up physical altercations they decide to write up physical altercations either as horseplay, which is a general violation, or as a fight, which is a serious violation. Among people who received violations or infractions, Black people were on average nearly 50% more likely to receive serious or major violations compared to all other people. Once a violation is given, classification staff determine how many days of restrictive housing should be imposed for punishment. In some cases, for example, fighting, staff can choose to impose as few as 3 or as many as 7 days in restrictive housing, depending on whether an injury occurred, without clearly indicating when 3 or 4 days or 6 or 7 days should be imposed. Providing ranges such as these without providing very specific and clear criteria for when to assign a lower or higher number of days in restrictive housing provides an opportunity for bias. To address this issue, we recommend that DAJD reduce discretion in discipline, check for racial bias in the frequency of infractions and days in restrictive housing, and make changes to its disciplinary system to reduce racial disparities. We also recommend that DAJD require regular training on bias and racial justice so that staff can better identify disparities and their potential causes. While DAJD concurred with some of these recommendations, they did not concur with our recommendation to remove day ranges or clarify when to use numbers in the range. This means the risk will remain that 2 people written up for the same rule violation can be sanctioned with different amounts of days depending on staff discretion, with no guiding criteria for when it should be the lesser or harsher punishment. DAJD does not need to revise its sanctions to implement our recommendation, but rather give staff guidance on how to apply them to ensure consistency. Review, our audit discussed how proximity can contribute to violence, that psychiatric needs have grown in the jails and the need for psychiatric housing exceeds the supply, the frequency and manner of deaths in custody at county adult jail facilities, and the racial disparities that exist in housing and discipline. Our full report can be found on our website. I'll close by putting up resources relating to some of the sensitive content in this presentation on the screen. Thank you very much.